What is an ovarian cyst? Ovarian cysts are solid or fluid filled pockets in or out or around the ovary. They are common and during reproductive periods of the woman. Women may get a functional cyst monthly, which disappear, especially after ovulation. Then it becomes a corpus luteal cyst. A cyst becomes a problem when it does not go away in a woman, or the cyst is growing bigger and bigger and giving certain symptoms. Ovarian cyst symptoms, most cysts do not give problems, but others cysts may give problems like pain, bloating, a dull pain, irregular menstruation, abdominal pain, pelvic pain, and so forth. Sometimes cysts need emergency attention, whereby the cyst become all of a sudden acutely painful, and the person have sudden severe pain sometime with fever and vomiting, dizziness with weakness, fainting as well, or short of breath. Those are the symptoms which will present from the ovarian cyst and which the patient must sought attention of a doctor immediately. What causes ovarian cyst? Most of the cysts are functional. They are part of your menstrual cycle. Those we call functional cysts or follicular cyst, and usually grow from or until around 18 millimeter to 25 millimeter, or they hardly go above 3 centimeters. Corpus luteal cyst is another cyst which happen in every woman post ovulation. It's usually filled with blood and it will disappear with time. Polycystic ovarian cyst is a multiple of cysts found at the border usually of the ovaries, and these are the sign that the patient is not ovulating. Therefore, the patient have what we call PCOS or polycystic ovarian syndrome. Solid cysts are the most common and are the most rare, although it's very important that you should know about them. The commonest of them is endometrioma, which is caused by endometriosis. The other one, it may be teratoma, which also is a solid and need to be operated because it can turn cancerous. The other is cyst adenoma, which is benign. Most of the time, it's a borderline malignancy situation, and the tumor can be serous or mucinous. Cyst adenocarcinoma, it's rare, but it's always something we should put in mind in case somebody develop a solid cyst at the menopause period. What are the risk factors for ovarian cyst? Hormonal problem. In other words, if you're using any hormones to develop your cyst or to ovulate, like Clomid, fertility drugs like Clomid. Pregnancy as well can make you to develop ovarian cyst. Endometriosis can make you to develop endometriosis. Pelvic infection can make the ovary difficult to ovulate so that then it trapped the fluid inside. Then you develop a functional or even a cyst which keep on growing and becoming painful. A history of operation of ovarian cyst usually will lead to development of another cyst due probably to adhesions or irritation around the ovary, and then make the ovary difficult to ovulate. Ovarian cyst complications. You can have complications from ovarian cyst, like ovarian torsion, where the ovary tossed and is very painful and is cruciating in pain and need urgent attention. The other problem, the cyst may rupture as well, which may cause a lot of bleeding as well and even fluid in the abdomen and cause a lot of discomfort and excruciating pain. The cyst may also get infection, which also may cause pain and need a form of treatment. How to diagnose ovarian cyst? Firstly, make sure that the person is not pregnant, because if it's pregnant, you're dealing with corpus luteum or a cyst of pregnancy. Do a pelvic ultrasound and check at the ovaries and the uterus and everything, or do a laparoscopy, or do blood tests like CA125, whereby you're looking at antigen 125. Is especially sensitive to some ovarian cancer, although not specific to ovarian cancer. Ovarian cyst treatment. Most cysts go away on themselves. In other words, conservative treatment is very good. You may use pain medication during that time. You may even use contraception, which will suppress the growth of the ovarian cyst, usually after about 3 months. But some of the large cysts may not go away, and they may need what is called laparoscopic surgery to remove them. Laparotomy is hardly indicated now as an old method of treating. Therefore, laparoscopy is the only method which we can use to treat ovarian cyst. Even if it's cancerous, still laparoscopy is indicated in those situations. Thank you.